Okay, just checking on the technical side. We're having a few little bit of feedback, but I think we've got it sorted now. So just waiting for a few more to come in. Okay, so I'm sure you've been enjoying the sunshine that we've had this week. It's been, well, I guess you get it all the time in South Africa, but we've been getting some of your sunshine over here too in the UK. It's been very warm. In fact, some say it's been too hot, as they say over here. But no, it's been fantastic. And I'm sure many of you have worked on the challenges this week. I've got an apology to make. Firstly, who I said was going to be presenting today is not presenting, but we still have someone good. So stay tuned in, especially the guys. I'm sure you'll recognize the voice from the person. So lovely to have you with us. And before we go any further, before we start looking at the testimonies from last week, I'll just invite Jonathan to come in with our disclaimer. Jonathan, you'll need to unmute.
Thank you very much, Sharon. Can you hear me?
Definitely.
Can you hear me, Sharon?
Yeah, we can hear you.
Thank you very much. Just like to say good afternoon to everyone, and thank you all for coming on this week. I hope the challenges went well this week. I did say to Edgar last week at his presentation, could you assured us that we would get some sunshine, and it was in abundance this week. So we are very grateful for that, and I hope you guys went out and soak up some of the sunshine. So as per custom, our disclaimer is only a physician can diagnose, treat, or prescribe for illnesses or disease. Any information disclosed or discussed at TTI International Zoom talk show or presentation and or live demonstration is for educational purposes only. Please continue to seek professional medical advice from your general practitioner regarding any illnesses or disease you may be suffering from. Thank you. Over back to you, Sharon.
Thank you, Jonathan. So who remembers what the challenge was this week? Anybody? You can unmute. I'll give you a clue. It's to do with 20 to 30 minutes somewhere. I know it says Edgar on my name thing, but that's my husband. I'm using his device. I'm Sharon, just to not confuse anybody. I'm Sharon Wallace. Okay, I will remind you the challenge was to spend 20 to 30 minutes every day exposing your limbs, your arms, legs, face, neck, to the beautiful medicine we have outside, free medicine. You can see some behind me, sunshine, okay? So I'm sure many of you were able to do that. So can I have some testimonies as to how you found it? You know, making that effort, because some people like to cover up. They're a bit shy about showing their arms, especially in some cultures. But yeah, let's see how you managed. Ooh. Not many of you went in the sun this week.
Yes,
Well,
I was in the sun.
Oh,
yeah, I was in the sun all week in my shorts. So I really soak up the sun. I found out that today we haven't got it. So I'm glad I took hold of it when it was around.
Good, good, excellent. You never know how long we've got it for. I mean, yes, it's there. Even when it's a cloudy day, it's still worth getting out there. But myself and the family, we went to the beach. We spent a few days. We went to the coast, and I was there with many of the other people of a lighter hue than myself. And we were lying on the sand on a towel and just soaking up the benefit of that free medicine. And it was lovely, absolutely amazing. And the sun is shining again here today where I am. So we've been for a lovely, nice, brisk birthday walk. It's my birthday today.
Oh, happy birthday.
So, and I'm sharing it with you lovely people. Here, there's more coming in. So for those of you who are joining us now, the presentation today isn't the same as what we thought it was going to be. Today, we've got a topic called testosterone crisis and the endocrine system, testosterone crisis and the endocrine system. And that's going to be presented by Jason Williams. And it is a family show. This is going to be something that's of importance to all of us tuning in. So stay tuned and you'll hear a lot more about it. Okay, do we have a challenge for next week? And whilst we're working on who's going to come with that challenge, anyone else who would love to give a testimony of your experience out in the sunshine? We did say that we didn't want anybody to burn, so hopefully you were careful. Temperance in all things. Anybody else?
I went out a few times this week in the sunshine. On Monday, I went to the park and I went into the park and I did some reading. It was really lovely being in the sunshine and the fresh air all around. On Wednesday, I had a picnic in the park after a nice boat ride on the river. And then on Thursday, we went to one of the lavender farms. And again, it was beautiful and sunny, even though after that, the heavens opened, but we got the sun before it came. And it was really lovely. It gives you this nice, clear mind, and it was, it gives you that happy feeling. So yes, it was lovely.
Amen. That sounds fantastic. And there's something you said that triggered something that I was thinking about, but I can't remember what it was. But anyway, you followed your doctor's orders and you got your sunshine on Wednesday. And I'm sure you really enjoyed your time. Good quality family time as well. That's what I was going to ask you, Deirdre.
Deidre.
Deirdre, which country are you in?
I'm in the UK, London.
Okay. So yeah, you guys had it hot this week.
Oh yes, it was very warm. Yes, before we had showers and floods, which I got stuck in. Floods did. Yes. We enjoyed the sunshine. We had to stay safe as much as we could.
Yeah, with the rain, it's great though, because it is helping our greenery around to flourish, and it's nice. It kind of brings the temperature down a little bit.
Oh,
and
yeah.
so God knows what we need.
Indeed.
He knows what we need. Water,
Indeed.
again, is one of our doctors. Sorry, Deirdre.
I'm just agreeing. Yes, he does indeed.
Yeah. So, who's doing the challenge for today?
So Sharon, we'll take one more testimony. Somebody probably have a burning or issues they want to share with us, and after that, we'll go straight over to Jason.
Okay. Is there anything in the chat? No? Okay. We have quite a few people coming in still, so that's good. So if there's no more testimonies for this week, I'll give you a couple more seconds. Grace. Go on, Shirley. It's okay. All right then. So I will hand over to our speaker for today. He needs no introduction really, but I will introduce you to him. He's a good friend, Jason Williams, a medical missionary over there in the lovely South Africa. So Jason, would you like to unmute? And before you speak, I want to know, did you do the challenge, Jason? Jason, I see you smiling. Can you unmute?
Hello, good afternoon, everybody. Can you hear? Am I audible?
We didn't hear you say what you did about the challenge.
You know, this mic thing, sometimes you miss, you know, so I did do it, Sharon. I did.
Was that I did or I didn't?
I did not.
Oh, you know what? You get it all the time anyway.
Yeah, that's it. Look, even now I'm getting it. Yes, don't worry, I get it.
Yeah, we can see it.
Don't know why
Yes.
though.
Okay, so for those of you who are new on this setup, this is True Temperance International, our family show, and this week our speaker is Jason Williams. So without any further ado, over to Jason.
Hello and good afternoon, everybody. I trust that everyone is doing well. It's indeed a pleasure to be able to share with you once again on this platform. It's been a moment now that I have not, joined in this manner in terms of sharing, but we have been following. I've been following the programs. I remember all of them, Dr. Thomas Jackson, and then Alvin McQueen for the past two weeks. So I have been following the presentations very well. Just like to say to the ministry, DTI ministry, thanks once again for giving me the opportunity to be able to meet you on this platform also and share with your audience and our audience here in South Africa. I'd like to say welcome to each and every one. It's been hectic on our side. You all know that we run this wellness clinic down here in South Africa, in Pietermaritzburg, and it's been hectic. We've been trying our best to launch a second center in another part of KwaZulu-Natal, which not trying, it's going, it's running, and so that has been taking up a lot of my time in terms of my availability to share with you guys, but that's what it is. We are opening up a second center and it's going very well, and for that we are thankful. The past 2 or 3 presentations, I think Dr. Jackson and Alvin McQueen, they spoke about the mind, how the mind functions, and then last week I think Alvin spoke about sunshine, I believe, and sleep and all that stuff. I was able to catch bits and pieces of it. That was wonderful. And I know everybody is being blessed who has been on this site. I know everybody is finding the programs very interesting. Myself, my previous presentations have been in regards to men's health. And today I will continue on the same line in dealing with men's health. Now, just to recap, in regards to men's health, I have been taking it from different angle, and today I will do the same. I will take it from a different angle again. The last time I spoke is in regards to, does anybody remember? That's a quiz. Jonathan, do you remember the last time what I spoke about?
That was a long time ago, Jason.
Mhm. You know, one of the signs of low testosterone is forgetfulness. Hey, and it's also involved in other things, but it was to do with premature ejaculation and erectile dysfunction. And we mapped it out according to the nervous system. If you remember, the parasympathetic nerve and the sympathetic nerve system. We saw that one of them was important to the other, as one of them was able to make things point, and the other one was to make things shoot. And we concluded that if these systems are not working at optimum and there's a fault, then you will have a problem in pointing and a problem in shooting. Today, I will continue down similar lines. We were looking at the brain and how the brain communicates with the male reproductive organ, and that was the nervous system. Today, I will look at another system that communicates with the male reproductive organ, and that's the endocrine system. The endocrine system, how the body works with that system to communicate with the male reproductive organ. That's the angle I'll be taking it from. The next one in the series is going to be the circulatory system. The circulatory system, how the circulatory system communicate with or can help the male reproductive organs to work. So we're covering all systems, and we're ending them with the male reproductive organ. All right. But before I go any further, we do a lot of work here in South Africa. This week was one of those weeks where we had our inpatient, and I have got somebody who was here with us, a male, who will be telling you about his experience with us over the past 5 days. He went home yesterday, 5 days. And I just want you to listen in, and it's a very important testimony, as it is what we do. And so a lot of time we talk, but it becomes theoretical at a point when you keep talking. But for us, because we're in the practice, I just want to use this opportunity to share with you that what we say actually work, and the understanding that we have of the body is crucial in how we can achieve health or restore one's health. So today I'm going to ask my good brother and friend, Mr. Bongani Pagati, if possible, can you come make yourself known, Mr. Bongani, and give them a little testimony? Welcome on.
Hi. Good afternoon here in South Africa, everyone. My name is Bongani Pagati. I was a patient at Kwamqemane in Pietermaritzburg, just like Jason has said. I was admitted because I had a problem with my sugar diabetes. I had been in hospital Wednesday last week, what was it? I can't remember the date, wherein I was put on the metformin, and the dosage was increased to 850 milligrams twice a day. And it was just killing me. It was making me vomit, making me have diarrhea.
I don't know, technology.
Sorry, somebody's talking. Oh, okay, can I go on, Jay?
Yes, moderator or host, can you please mute everybody so Mr. Pagati can carry on? Jonathan, Mr. Pagati, we cannot hear you. Can you undo your mic, please? Undo your mic, please, Mr. Pagati.
Then you have to unmute him.
Unmute, yeah, okay. Can you hear me now?
You're on mute now. Can you rewind and continue, please, sir?
Okay, all right. So I was admitted then for the sugar problem because it was at around 21,2. Then they put me on the diet program and on the entire program, wherein I had to change my diet, my lifestyle, and everything. So on the first day I came in, the sugar was at 16. Then the following day, it dropped down to 13. Wednesday, 13, Thursday, it went down to 10.5. And then on Friday, when I left, it was around 8. Then today, I tested myself at home now, it was 6.1. So the program works wonderfully well. And I think we need really to encourage a lot of people that sugar diabetes can be beaten, because ever since I started on Monday, in fact, I voluntarily decided on Sunday last week to be out of the tablets. That is sugar diabetes as well as hypertension. Up until now, I have never taken any tablet. I'm only relying on diet and exercise, and it's working very well. I'm healthy, I'm strong. In fact, I'm strong everywhere, above and below, because Jason has also put me on another medication for the male reproductive system, because I was starting to lose the energy down there. And now, even at night, I can feel some movements. And because I was starting to have a problem with my urine, it could be, stopped for a while and then go on. So now it's free, there's free flow. Now I feel like a man, and yeah, I'm ready for the next game.
All right, and Mr. Pagati, you remember when was it? Was it last Saturday you called us out, wasn't it?
Yes.
You remember what
Saturday,
we done?
I was dying on Saturday because after coming out of hospital, the tablets actually almost killed me. I was vomiting again Saturday morning and diarrhea, and I had to call you guys, and you came in, put me on a drip, and I was fine. The following day, I was perfectly fine. That's when I decided then that I'm going to stop taking these tablets. So yeah, and then I joined the Endocrine Wellness Center on Monday. And
another thing, guys, Mr. Pagati, when you came in here, do you remember how much you weighed on Monday?
Oh, yes. That's an important one. When I came in, I weighed 15 kilograms. And when I left, I was on 105 kgs. I lost 10 kgs in 1 week, because they also put me on the what you call colon cleanse irrigation system. Yeah.
Mm-hmm. Okay. Yeah. And for those of you who don't know what that is a colonic irrigation. It is right here. It's right here. I'm actually in the room. That's the machine right there that we used to do that. Okay. Yeah. We'll clean you out. It's different from a localized enema because this one goes high up the colon. We have a system that we can pick up the pressure in the colon, so we don't force, but we can see where there is a blockage once we start inserting our water. Once we know there's a blockage, then we can adjust it, let out the water, remove the blockage, and continue, and then we can see from the pressure that the blockage is changing. So thank you very much, Mr. Pagati, for that wonderful testimony, and I pray that the Lord may continue to grant you favor and continue to heal you as you tread the path of wellness. May God bless you as you do so.
Thank you very much. Thank you very much, Jason, and keep up the good work.
Blessings. Thank you, sir. All right. So that's for those of you who you've heard us. We have been talking all the time. So that's a testimony for you from a recent guest in our institution here in South Africa. And that's one of many. It's a thing that we do all the time. Now, this is a male health program, but let me say this. Don't be discouraged because it's a male health program. The reality of it is, when we see patients coming here with male problem, listen up carefully. A lot of the male issues, the wives didn't know when it was an onset. They were seeing changes happen in their husbands, and some of it led to arguments, some of it led to other disruption in the relationship. Some of it just went under the mat silently until it became worse and worse and worse. This is a male health program. Women are more than invited. As a matter of fact, I strongly emphasize that women do take part and sit on and listen carefully, so you may know the health status of your brother, your father, your son, and your husband. Men do not like to go and visit the doctor. We all know that. That's a stat. That's a common, that's a say. That's a go without say. Therefore, females, the more you understand about male's health, okay, let's come from behind the curtain. The more you understand about men's health, you will be able to see changes happening in your husband. You could listen to your husband, listen to them at nights. We know what I'm talking about. Or your brother or your son or your father in the house. And you can hear from their urination that things are not right. But do you even take note of that? Do you understand what that is saying? Yes, when you know what they used to sound like. They used to be urinating, and now you're hearing a stop and start. You're realizing they go into the toilet a little bit more often now. That's not something they used to do, but you're seeing these changes taking place. Do you know what it means? So this program, though it's a men's health program, it doesn't mean that women are excluded. As a matter of fact, you are very much welcome to be a part of this program, the TTI Family Health Show. It is about family health. Today's subject is about men, women. You are welcome to participate, listen, and even ask your questions. Okay, today I'm going to speak a little bit about that male testosterone and the endocrine system. Once again, welcome to each and every one. I see people there as far as from Zambia. I see my good friend Alvin McQueen. I see quite a few folks here. Well, wow. Anyway, thanks for your support, and I pray that you may learn something from this presentation. Admin, I need to get my screen up, screen share, and I'm looking for a screen to be shared. And I think this is it. Let me see. I think this is the screen. 1 second. And it's coming. Am I sharing my screen?
Yes, you are, Jason.
Thank you very much. Okay, summary from the last presentation, premature ejaculation. Okay, it's got specific definition. We know that if you as a man and you are not able to go beyond, say, about 2-3 minutes, you have a problem. There is something going on. We also understand that that may be the case for many men naturally because they were born like that. But if you're a man and that's not how you used to be, and this is a new change coming up on you, then there is a problem. Okay. Erectile dysfunction, another issue that men suffer from. Men, as we get older, we are not supposed to lose male potency. It is accepted that way because of how things are and how society is now. But the reality is you are not supposed to lose male potency at no time soon. It's something that's supposed to stay with you throughout your life. But because of degradation and so on and so forth in our current environment and world that we live in, then we're seeing this as a norm, but it is not supposed to be so. Okay, that's just a recap. Kwamtamani Institute of Wellness, Healthy Living, your education and wellness center. Our motto is this: health is not everything, but without health, everything is nothing. At this point, I want to just check something. Dr. Kamosa, are you on? Have you made it? No? Not hearing her? Okay, we will continue. Okay, today's topic. 1 minute, guys. Let me get this thing. Yeah. the screen. I'm trying to see my screen, but you're seeing it more than me.
Jason, is it possible for you to move that little box from your presentation screen?
That's what I'm trying to do. I don't know how to do it. I want to move it and I don't know how to do it. That's the problem. I don't know how to move this box. Let me get my technical fella to give me a hand. I want to move these things so I can see my screen better. Okay. Yeah, these ones, I want to remove them. These ones? Yes, please, if possible. Because it's covering my words. Even these ones are covering my words. I can't read them. Okay. This one, this other one. This is what? It's just saying something I don't understand. These people that people are waiting, they're waiting. Okay. What should I meet them?
While we're waiting for that to happen, just to direct some of you to the chat. In there we have the link to the YouTube.
I'll try and work around it.
Sorry about the echo. And also the link to the women's WhatsApp group. So I'll repeat that. In the chat, we have the link to the YouTube and the link to the women's WhatsApp group. That's an invitation. If there are any men that would like to join the men's WhatsApp group, I'll ask one of the male admins to post the link, post the invitation. Jonathan, if you could do that, that would be good.
It disappears. I'm not going to do something. It disappears. Yeah. All right. Don't worry. I'll work with it. All right, guys. I'm back.
That's
Sharon.
done, Sharon.
Sharon. Can you hear me, Jonathan?
Yes, Jason, you may go ahead.
Okay. Right. So our topic today is testosterone crisis in the endocrine system. This is, I at some point I won't be able to see my screen because there's something that's blocking my screen here and I can't see it so well. But I'll try and see if I can get to it from my phone. At least I will be able to see it there. Okay. I'll try and connect. Okay. What we'll be covering today is what is the testosterone and its function in the body, where in the body it is produced, and how do we know if we have low testosterone, what a normal testosterone level, and what to look out for, and what some of the causes of low testosterone. And I've got there the crisis. That's where we need to look out for, the crisis of testosterone. How can I raise my testosterone level? Can food, supplement, and herb actually boost testosterone level? Okay, that's what we'll be looking at today. So what exactly is testosterone? The human body, as we know, is very complex, made by the Almighty himself. At least I believe that. Now, as I was saying, the last time we presented, I showed how the nervous system connects and works with the male reproductive organ. Today, I'm looking at the testosterone. Now, what are hormones? First of all, what are hormones? Hormones are chemical messengers that secretes into the blood directly, okay? And it's taken to organs to carry out their function based on what that organ is supposed to do, okay? Today, and there are different hormones in the body. The most prominent one in men is testosterone, in female is estrogen. We go through these changes, men as well as women. When hormone level changes, we see things happening, or we experience, some of us, we become different people if we are not careful in these changes. And so hormones are powerful chemical messengers, okay? Today, the male one is what we're looking at. Present much in a greater level in men than women. Testosterone initiates the development of male internal and external reproductive organs. during fetal development. Now, what that's saying that if even before the child is born, there is the hormone is taking, the hormonal changes and reaction is happening there. Okay. Right. My screen is blocked out again. Okay. It's essential for the development of sperm and the production of sperm as well. Do bear with me. Sometimes I'm not able to see the screen because half of my screen is sometimes getting blocked. So sometimes I will just work from memory and tell you what I remember from what my reading is. Okay. The hormone also, or this hormone also signals the body to make new blood cells, ensure that muscle and bones stay strong during puberty, and enhance libido. Both in men and women, testosterone is linked to many of the changes seen in boys and adults, I may say, during the puberty years, including the increase of height, of body and pubic hair growth, enlargement of the male reproductive system, the testes, prostate gland, and also you will notice as these changes take place in the young men, they start seeing and feeling different in regards to the opposite sex. So that's, you know, their sexual behavior start to change. Okay, that's pretty much what testosterone is in a nutshell. Of course, I won't be able to share everything with you about what testosterone is and what it does here, but I want at the end of it, we get a general gist of the importance of proper levels and what it is and how it functions and what we can do to keep it at optimum. That's the objective of this presentation, not to make you a doctor in an hour and a half, but so you can understand what's happening in your body as you go through this life. Okay. This is just a little diagram I pulled up to give you an idea of the changes that we go through as male, okay? And you see years and age attached to the first one. Male starts puberty between 10 and say about 13. They have what you call sexual maturity and development, and that takes place physically and mentally. There's hormones changing, things are growing, things are happening, you know, muscles are becoming big, men, the voice are changing, everything is happening. And this is the changes that takes place as the testosterone does this thing. Now, testosterone is a very, very powerful thing, and male and female have testosterone, but it's predominantly a male hormone. It works on both sides of the fence with men and women, and it helps all our organs, and especially our sexual organs and reproductive organs, to function well. Okay, when these hormones is gone funny in a woman, when you get extra or too much estrogen level, testosterone level, it messes up your estrogen. Okay, a lot of time what will happen, you will see women with hair on their chest and their chin. What's happening is the body trying to balance out the estrogen as it gets much. And so what it does, because the testosterone is a male hormone, as it raises its level to try and balance the excess of estrogen, because it's a male hormone, it causes you to grow hair and blah, blah, blah. You will see a woman growing hair on their chin and on their chest and so on and so forth, because now the male hormone is trying to get a little bit much more to balance the growth, the extra, you know, estrogen. All right. So that's what I wanted to share at this point. Both male and female share testosterone. Okay. Where in the body is testosterone produced and how? The brain is an amazing thing, and we know that's a controlling unit. Okay. The regulation of testosterone production is tightly controlled to maintain normal levels in the blood. And it says tightly controlled. That means it's like the temperature of the body. It's very much regulated. It's tightly controlled, because hormones can ruin you. Literally, you can become mentally ill just from hormone getting out of control. So this is a very tightly controlled system, although levels are usually highest in the morning when you wake up. Men, now you understand why when you wake up in the morning, things are high, if you know what I mean. You know, as you get older, you want to know if things are changing. You will notice that in the morning, things are not happening as it used to. Okay, now that's not always the case that testosterone level are getting worse. Sometimes a stressful situation can cause that. But if it's the norm and it's just becoming the norm, then you know there is a problem. Okay, all right. The hypothalamus and the pituitary gland are important in controlling the amount of testosterone produced by the testes. Now, here we have an organ, a very little small, the pituitary gland is a small little organ there in the brain. That but it's very powerful. Yeah, it's very powerful because it controls the chemicals. And so what's happening here? We got this small little pituitary gland that's speaking to this organ way down here, and it does so by chemicals. Okay, whereas the last time I did my presentation, we noticed that the brain produced via information via what? The central nervous system. It spoke to the male reproductive organ via the nerves. Here we're seeing that the brain speaks to the male reproductive organ via the what? The chemical, the endocrine system. Okay, that's how that system works. It releases into the blood certain chemicals that there's receptors down there that is able to take that information and it causes it to do what it's supposed to do. All right, that's the chemical reaction that takes place at that blood. It responds that way, okay, in releasing hormones. Okay, the pituitary gland produce luteinizing hormone, which travels in the bloodstream to the gonads. Gonads mean your testicles, men. That's another name, and stimulate the production and release testosterone. And then the testosterone is produced in the body. All right. This is the brain way of communicating with your male reproductive organ. It uses chemicals that starts, the signal is sent here from your pituitary gland. Okay. And then it gets into your bloodstream, tightly controlled, of course, and it sends signal down there. The receptors pick it up and you produce testosterone. That's what happens. That's how that process takes place. Okay, starts in the brain and then move down to your bloodstream. Now, this is just a little picture to give you an idea of where the pituitary gland is. One of the bigger part of the endocrine system or organ of the endocrine system is your thyroid. It produce thyroxine. And if the thyroid is messed up, you can have serious problems, yeah? You can have serious problem with a broken thyroid. You have the parathyroid system, which is behind the thyroid there. This can create a lot of havoc in the body. And so that is a crucial organ. Then you have the, let's see, I'm not seeing my screen now. Then you got the pancreas and the adrenal glands. The adrenal sits on top of the kidney, another powerful one as well. They said that it also produced some testosterone. I heard that in my research. I didn't do a secondary research, so I don't know fully, but I did read up on that your adrenal glands can actually do that. Your pancreas, which you know it produces insulin, helps, and other things as well, but that deals with the control of the sugar release and uptake in your blood. And then of course you got your testes. In female, you got your ovaries, and they produce different things. The male reproductive organ, the testes, it produces testosterone. Female, you produce estrogen. Okay. Now, how do you know if your testosterone levels are within normal range? You can go and see your doctor. They will do a blood test. They also have home kits that you can use, okay, to check these things out. So if you want to know your levels, go to your doctor and ask them for a blood test to see what's going on. We do it here in our clinic in Pietermaritzburg. For those of you who are here in South Africa, if you want that test done and you want us to do it for you, it's fine. All you need to do is get in touch with us, give myself a call or Dr. Komonso, and what we will do, we will find out where you are, wherever you are in the country, in South Africa, that is. We will send a request form to you via your WhatsApp or email, and you take it to the labs, and we can get your blood tests done. They will do the bloods. You just go there. They'll prick you, take your bloods, and then they will send the results to us. You don't need to sit down and wait for it. Just go there, do it, boom. Then once we get the results, we will contact you, and then we will discuss with you what your levels look like. That's for men in South Africa. If you want us to request a testosterone level test for you, you are able to do so by just giving us a call. We will arrange it wherever you are in the country, and we will give you the true result and reflection. Best time to take it is in the morning, and maybe more than once as well, because testosterone levels, it does that. It has a range within which it works. Now it goes up and down. So, it's best to do it early in the morning, and probably more than once as well. So feel free, contact us. We are able to do and request those tests for you. So how do you know if you have that? Go to your doctor, request a test, or ask for a home testing kit. I think if you ask in Descam in South Africa, Descam is able to do that for you. I don't know the cost, but you can get it, okay? I can't see my screen here. Okay, the normal range in males is about 270 to 100 to 1070 in nanograms per deciliter. Okay, that's the measurement they use, nanograms and deciliter. Okay, within a range level, the average range, sorry, my screen is going funny again. Range is about 679 nanograms. That's average. If it's lower than that, then they might want to do further investigation. We have seen folks with it far, far, far lower than that in our clinic. I mean, way lower than 270. I mean, on the ground, actually. And what we notice with those men in general, they have a lot of health issues. One of the things, they don't recover so easy from things. If you have a sore, or if you have issues, anything, a joint that you hit on, or something, whatever, a bounce or bruise, you don't heal so well because the testosterone levels are low. So a normal testosterone level peaks at the age of about 20. That's when things are up there, very high, and it goes on till about 30, 35, and then it starts to decrease. It stays between that 270 range, between 20 and say about 35, it stays between that range, and then it starts to go down. The testosterone levels above or below the normal range is normally considered as an imbalance. So between, say, 400 and 600 is optimum. That's what you will say, that's good. So if you go to the doctor and or if you ask us to do a test for you, and we tell you that it's 60 or something like that, then you need to be concerned. The optimum or a good place to be is between, say, 400 and 600. That's quite stable. Though there is some argument that people or races have different levels, which is normal, and some people have higher levels than others, which is classed as normal. Okay, but that's what is recognized in the field of medicine, about 400 to 600, then you're in place. Okay, as you get older, remember, it gets lower. So what to look out for? The crisis. Okay, the crisis kicks in at this level. Now, modern lack of testosterone, it doesn't, okay, normally age related, it goes down, but it can affect you even at a young age, okay? You have what you call andropause, which is it's like a male menopause, okay? Women, you have menopause, men, you have andropause, okay? And then you have, that's as you get older though, you hit that, you hit that system, okay? Right, I don't see my, okay. A collection of symptoms, including fatigue and decrease in libido experienced by some older men. That's what that andropause is, okay? Hypogonadism is another way to understand that your body is not producing enough testosterone. That's when your body is not able to do it, okay? That's what they would call it. But that is not necessarily age related. That could happen to you even at a younger age, okay? But the andropause is when you get older and things start to change, like menopause, okay? Here's a little picture. I hope you could see it. The fully colored orange reddish man the red represent high testosterone level, and you can see as it gets to 30, 40, 50, it drops and drops. And by the time, if you live that long, by the time you're 90, it is almost on the ground, your testosterone level. But with proper lifestyle and proper diet and understanding how the body works, it don't necessarily have to drop like that, okay? You can have it maintain a good balance, and so, you know, you'll be able to experience good health. Also, want to say this, if you have low testosterone level, you can reverse it and pick up on your levels, okay? Some of the things that normally happen when things start to go wrong: depression, obesity, anxiety, poor concentration, memory loss, irritability, low sex drive, restlessness, low libido, and weight gain. Now, all of these signs here, it doesn't necessarily mean because you have them that your testosterone level is low. It could be other issues that's affecting you. So, you know, if you have, say, these symptoms, a couple of them, not all of them, or one or two of them, don't just rush to the conclusion that, oh, my testosterone level are low. All right, rather go, and if you think it is low, go and check it out. Check out with your doctor and your healthcare provider. Let them do a blood test and see if your testosterone level are in check. Okay. Here's a picture again. You can see it. Low testosterone, and that one over there on your right is norm. Depression happens. It happens here. You don't feel like you normally do. Now, can you imagine, men, women who are listening? You're used to your husband being this Superman almost. And here comes, and remember, it happens slowly, okay? These changes start to take place. And you're wondering what's going on. Remember, men normally don't want to, because of, you know, we want to be the man. We don't like to give off that we are weak. And so we will hide it from you, okay? But the changes are prominent. They're very real. You're seeing them. And sometimes the man is feeling it, but he doesn't want to admit it, okay? You must remember, changes take place with men, like changes take place with women. And it's real. The world that we live in, we hear more about menopause and the changes that take place there. And enough, I don't believe that enough emphasis has been placed on male issues in regards to the changes that take place as we get older. A lot of homes, a lot of lives have been ruined because of these simple changes that we experience as men and women. It has ruined lives, okay? Sometimes it's just something that's taking change and somebody behaved because of chemical reaction and it ruined lives. Now, if one was educated and understood what was happening and they were sharing information with each other within a relationship, you would be able to better understand what's taking place in your partner's body and know how to maneuver and how to help that person, especially women. The reason why I stress that women should be on here. A lot of these things happen because of what is prepared on the table. A lot of the food that you prepare, a lot of the things that you give your husband to eat, a lot of it's the imbalances start there, to be honest. And so it'd be wise to understand, or stay to the end of this program. We'll share some of that information with you for you to understand what to cook and what not to cook. Some of the causes of this low testosterone, it's normal to make less testosterone as you get older with age. But things like the pituitary gland being problematic or damaged because of, Alvin spoke about music and stuff the other day, it damages a system. When these systems are damaged, it can cause that problem, autoimmune disease, HIV infections, and stuff like that can affect your brain. Damaged nervous system can really affect that system. Diabetes, terrible disease to have. You heard the testimony, it is not a death sentence. Everybody that have diabetes, it is your body telling you that there is too much sugar in your blood. That's it, okay? It is not a permanent disease unless you ignore it and it damages your organs, okay? Even then it's not permanent. A lot of repair can be done. I'm telling you that. You've heard the testimony. The gentleman that came on is not the first. He's not the first that we have helped. It's a common, our success rate with diabetes is quite good. Our success rate with blood pressure is quite good. We understand what the body is doing. And so anatomy and physiology is number one in how we operate. We find our cause to effects because we understand, just like I'm sharing with you, some information of how the body makes testosterone. When somebody comes to us and we understand, after we consult with them, we do a holistic look at what is going on with the person, not just a symptom look. We look deeper than what they're feeling. They come, they say, hey, I'm feeling this, I'm feeling like this. Okay, it's either this or it's either that. Let's zoom in a little bit. Then we do our blood test, then we isolate the problem, then we know what we need to do. Then we apply the changes and whatever, okay? So BP, some medication that you take can mess up your hormone system, okay? Most of the above can be caused by poor diet, poor dietary practices, and lifestyle practices. Just that alone can mess up your hormone men. There is something that I spoke about briefly in about, not the last presentation, but the one before that, where I spoke about prostate health. And it's this. When a man have a prostate issue, remember men, listen up, okay? When we have a prostate issue, as men, what normally happens as we have a prostate issue, they say we have high testosterone level. Now, if you think about it, I've just shown you from the diagram, at the age of 20 to 30, your testosterone is way up there. Why is not your prostate getting enlarged and damaged at that point? That's when your testosterone is at the highest. So how comes as you get older, they start telling you, oh, it's because your prostate, your testosterone level is high. That's why that is a problem. You understand? Now, in fact, that's not what's going on. It's not the high testosterone level that's causing the prostate to have a problem. Yes, the testosterone level is high, but the real problem is in the men, what's happening is a hormone imbalance. So what's happening? Your body's, because of lifestyle and dietary practice, your body has taken in too much of the hormone that a female is supposed to have. It's called estrogen. And so what your body do, as it does in the woman, the opposite, it raises the testosterone level to try and do what? Control your estrogen level, because it's a dominant thing there. You see, the hormone testosterone is dominant in men. So when there's an elevated amount of estrogen that gets into your system, the body tries to bring it under control by raising its own testosterone level. So they're associating the high testosterone level with what? The benign prostate hyperplasia or prostate cancer, or prostate changes, prostatitis and all that stuff. They're saying that it's the high. No, if it was the high testosterone level, then men will start having most prostate issues in their early 20s, because that's when their testosterone is at the highest. But that's when their estrogen level is very much at the lowest. It's under control at that point. But as you get older, okay, and the accumulation of toxins starts to build up. I've got another presentation where I show you step-by-step stages of diseases. Perhaps one day I'll share it with you, where at a point these changes start taking place because there's too much toxins in the body. And as you get older, because you have not been replacing your nutrients, you have deficiency and toxicity. Toxicity at its height, deficiency at its low. And so you create imbalance in nutrition, and then everything else starts to go imbalance. So high levels of testosterone in a male who's got prostate problem is not caused by the high level of testosterone. On the contrary, okay, you need to have testosterone so your body can heal and recover. And that we know. And the worst thing to do, okay, if you don't know better, let me say this. One of the worst thing to do is to get the testosterone replacement treatment, the hormone, the artificial things put in your system. That's going to mess you up, okay, in the long run. There's many ways we can deal with it. But for today, let me not go too much into that. BPA, it's a weak synthetic estrogen chemical found in plastic, rigid plastic products, plastic bottles, you know, like the bottles you drink water out of. Oh yes, it's got that in there. If you got, and it really disturbs. Remember, it's not the same day you plant a seed that it brings forth fruit. So it's a little bit of BPA today, a little bit next week, or a little bit tomorrow, a little bit from this and a little bit from that, with some bad diet, not enough exercise, some junk food here and there. Those things add up. And if they don't come out the body, if the toxins don't come out the body, then it has no choice but to make changes in the body, negative changes. Okay, so this chemical in BPA, one of the big causes, I highlighted it, in plastic products. This is an estrogen-like chemical, and it disrupts your hormones. It messes your hormone up. Men, nowadays, we're drinking and eating out of plastic, we're eating out of tins, we're eating out all kinds of things, and those things are accumulating in our bodies. They're accumulating in our bodies, and as we go, we're not getting enough nutrients, and as we go through, we are, you know, getting sicker and sicker and sicker. I think Dr. Komosa has just come in, or she's on her way in. You can write your questions now, guys. She will answer. All right, that's my backup plan. Anyway, yes, so that's in regards to that. I'm a bit distracted because I'm trying to read off my phone as well. All right, let me try and move my slides on. I think my computer decided to freeze. I don't even know if you all can hear me. Can everybody hear me? Jonathan?
Yes, we can hear you, Jason.
Okay, yeah, because my computer, things have gone wrong on my side here. My screen is frozen. I can't get nothing. All right, hold on. I think we're coming back. Okay, so men, pull your pens out or pull your memory stick out in your head. I got a little quiz for you. I want to do this quiz for you to know if there's changes taken in your body. Of course, this is not conclusive, but it will give you a good idea to see if you are having changes. Okay, men. So here's a quiz for men. Okay, you will see if you answer 4 in 1 or 2 of this, then there's a chance that hormones are starting to go funny. And if you are getting marks like 3 and 4, 3 and 4, 2, 3 and 4, and you're a young man, then you do have a reason to be concerned. Okay, you do have a reason to be concerned. But men, if you're over the age of say 35, 40, 45, and so on, you see you're hitting 4s, and you have about 1 or 2 4s after this quiz, then there's changes taken in your body, and don't be worried. There is things that we can do. Okay, all right. Some people, remember, you are born with an imbalance, and so injury and stuff like that can also cause it. Diseases and medication can cause it. So bear all these factors in mind as we do this quiz. So how would you describe yourself? You see the first question on the left hand side of your screen. It said, I would describe my sexual desire as what? Healthy and vigorous. And that, man, is going to be left up to interpretation based on who you are and how you are. But do you think yourself, you know, wanting to go that way often? I remember, I think one of these pastors, I think his name is I don't remember his name. Anyway, he was saying that this lady in his church says, "Hey, pastor, I think my husband is possessed." And the pastor said, "Oh, is that so, my sister? Why?" And the wife goes on to explain by saying, "Hey, this man, he keeps running me around the house. He always wants, his sexual desire is so much, he always wants, I can't get a rest from him." And that is all natural, man, out of control somewhat, but it's natural in the sense that you are supposed to feel that way. You are supposed to have a balance and a control. But if you have that desire towards a woman, it doesn't mean that you are possessed. Wives, it doesn't mean your husband is possessed if he wants you. Okay, his testosterone level, he's healthy, he's seeing you, he's got his chemicals are working, he's seeing you. And the pastor turned to the woman and said, "So you think your husband's got a demon?" He said, "Well, I've got something to tell you. I got a demon too, because I feel the same thing towards my wife." And so it's a good thing when you have that desire. When you don't have this desire towards your partner, then changes are taking place. So how would you describe your sexual desire? It is healthy? Is it healthy and vigorous? Do you feel like doing it occasionally? Is it a rare event? Or it just not there? What would you say? All right, if you get a 4 or 3 on that, 2, depending on your age, it can mean different things. Mood. Okay, my mood in general, is it positive? Is you upbeat? Are you happy? Are you, what is it that you feel occasionally frustrated, increasingly more frustrated, depressed? Where do you fall? If you come down with 4 again, then you need to think. Joint pains and muscle aches, is it none? Is it mild, moderate, severe, sometimes, no time? Those type of things. Severe meaning all the time. Is that a problem? And that is if you don't have an injury and there is a problem, okay? I understand that some of us have had injuries that has never really been healed because broken bone and so on. I have a wrist of mine that was broken for a long time and I didn't take it to the doctor. So now I have a permanent damage wrist. And so yes, it hurts me, but that's not the same. So I'm not talking about that, I'm talking about just in having pain. Okay, sleep problems, none, poor sleep, need more sleep, can't get to sleep. Okay, they will mean different things. So if you got 4, 4, 4, 4 so far, you are in a funny situation, especially if you are over 40. Decrease in muscular strength, none, mild, moderate, severe. In other words, you don't have no muscle decrease. If you're not decreasing the strength, you're still strong, you still got good muscle tone. All right, as we get older, and perhaps I'm creating excuses here, yes, you get a little covering over your big muscles. Also, I'm not talking about that. I'm talking about if your muscles gone, if you don't have no strength and it's becoming flabby and weak, none. Okay, if you still got good strength, then fine. If you're weak and just can't be bothered and nothing interests you when you sit down to watch the TV is watching you, all of that. Slow beard growth, if your beard's growing, no problem. Mild, moderate, severe. If it's severe, meaning it's not growing and you have a problem, then you have a problem. Decrease in the number of morning erection. If you have no decrease, then it's none. You're good. Mild, things are not so strong. Moderate, yeah, it happens, but severe, meaning, I don't remember the last time I had that experience. Then you need to look at your testosterone level. Your level of obesity, are you putting on a lot of weight? Is it not a problem? Mild, halfway obese, you're putting on weight, but you're not, that's the little markers that I've put there for you as a quiz. If you answer 3 or 4 for any of the question, you're likely to be having or starting to have a decreased testosterone level. I can say for myself, I'm in my 40s now, and I know I have noticed the difference. To keep my weight at a particular level is harder now. Before, I never used to have to worry I could eat less, I could eat more even, and my weight would not change. But now I realize that my weight have changed. Things have definitely changed. I can tell you that. However, I do experiments on myself as clinical observation. And so I will drink certain things and try certain things to see if I can get the changes to happen. Then I know I've got a winner. I just put 1 + 1 = 2. And I see, you know what I'm saying? And then you know that you're on a positive change. Some of these things we do at the center, as you can hear from the gentleman testimony, we are not just saying something. We actually do this in our practice here in Guantanamo. And a lot of men, they are not the man they used to be. And they have accepted. And I'm saying to you today, don't accept it. Don't accept it. Do something about it. Become the energetic man that you used to be. Become the upbeat man that you know. Wives, encourage your husband. If you see that they're getting older, they're looking, you know what's going on. I'm telling you what's going on. Their testosterone level is decreasing. And if you're not careful, it will just decrease until he becomes sicker and sicker and sicker. One of the long-term effect of low testosterone level, and even sometimes short-term, depending on how long and how bad this thing is Alzheimer's, yeah? Testosterone. It happens to men and women, okay? So look after your testosterone level, keep it up. How can you raise your testosterone level? Exercise, lift some weights, lifting, weight-bearing exercise is excellent for your testosterone level. It encourages, that's the physical approach. Eat protein, good source of protein, good source of carbs. Remember, amino acid is crucial in helping the body to make proper hormones and the different type of hormones. Minimize stress. Of course, we know that we live in this world of stress, but minimize it. Help your cortisol level to be controlled. There's herbs that can do it, diet can do it, and lifestyle that can do that, okay? So that's not a problem. So minimize stress, control that cortisol level. Get some sun. You know, vitamin D is crucial for raising your testosterone level. Vitamin D, you get it from the sun primarily. If you're living in a place, I hear that the sun is very good in England, in South Africa. You don't really need to, unless you have a serious deficiency. And by the way, it is one of the tests that we do for men and women in South Africa. Yeah, you have sun here, but what's the point of you having sun when you're not spending time in the sun? You spend time in your office, in your car, you ain't gonna get vitamin D, are you? Okay, so vitamin D is one of those things that is crucial for the production of testosterone in the body. Okay, take minerals and vitamin supplements if you think that you have some changes going on. And it's simple, guys. Look, as we get older and things change, yeah, our diet, our lifestyle, okay, the stages of toxins and deficiency is increasing. Toxins are increasing, deficiencies is increasing. That's all that's happening. You're putting in more poison, it's raising, and you're not getting enough nutrients from the food. So the deficiency is raising. So you might be deficient in sodium and potassium and magnesium and this decrease in these minerals is getting more and more and more. And so if you understand the body works in cycles, 7-year cycles actually, depends, and different organs, they have reproduction time, by the way, or renewal time, like the blood, you know, it's 120 days or something like that. The liver, the lungs, the kidney, they all have cycles that they go through once they have their proper nutrients and the proper environment, and nothing disturb the cycle of detoxification and renourishing, then the organ will actually refix itself or rejuvenate itself. The hands that you have on you now is not the hands that you grow with. Your hands have changed. The skin have grown. Look how big you are. Same hand. So once the internal organs are like that, once they are able to detox and be renourished, and get the right things they need, your body was designed to rejuvenate. It will rejuvenate. But daily, we're putting things in our bodies we're doing things that is interfering with the process of rejuvenation, okay? Whether it's not enough nutrients, whether it's a toxic load, whether it's a stressful event that interrupt the process of rejuvenation, whatever it is, you have interrupt the body way. So what you need to understand is by putting back the right minerals, the right nutrients. Now, I'm not telling you to go and live out of a nutrients from a bottle, but the truth of the matter is some of us, you cannot get it out of your food because your food doesn't have it. You have not got the right farming technique. The soil doesn't have the proper nutrients in it. So you will be wise to use some wisdom here and get some supplement, a good source, probably a plant-based one, and put it back in your diet and make sure your body has what it needs so your organs can function. Get plenty of rest and quality sleep. Sometimes, you know, not just, you must understand sleep as well. Not everybody requires the same amount of sleep. I have a sleep problem, but I also recognize I don't need to sleep for long hours, 8-9 hours. That's not me. And that's another story. You all need to research that if you wanna. It's called short sleeper syndrome, and you function just as fine with less sleep. As a matter of fact, you function as optimum as and even more than somebody that takes 8 sleep, but that is a genetic mutation that takes place in somebody's body. So if they sleep 8 hours, they don't function. And that's not because their circadian rhythm is out. That is because genetically, that's how their genetics are set up. So predisposed condition probably runs in the family. And so you need to understand that. Okay, if you're able to function, just check yourself out. There's tests that you can do to find out if that is your genetically predisposition, and you are able to function very well with not as much sleep as somebody that needs. But 8 hours, 7 to 8 hours is the recommended amount for most people. All right, so make sure you get good rest and take time out, recreate, relax, enjoy nature, take a break. Okay. Take some of these natural testosterone boosters. There's some out there. I will mention a few of them. There's loads out there, actually, not some. There's herbs and there's a lot of combination. You know, when you understand macronutrients and how they work and minerals and stuff, you can create things by putting them together. And that's more like a dietetics approach to health, where you're using nutrients as a medicine. Can food and supplements and herbal intervention actually boost your testosterone? Yes, it can. A vegan diet, and this is my personal belief and according to some research, however, this does not mean that one cannot achieve, okay? And what it's saying here, a meat diet is what they recommend, okay? A meat diet is what is recommended. I just copied and pasted this, but it's saying just because they recommend a meat diet, high testosterone level from a vegan diet, you need to understand that. And for those of you out there, you're in for a delight. Sister Charlene is going to show you something that you can do to ensure that you have the right nutrients in your diet if you do choose to become a vegan. Okay, so you can get a proper level of nutrients from just being a vegan. In fact, a solid plant-based food can boost your testosterone production and enhance overall health better, just like non-vegan. As a matter of fact, I would go further in saying better than non-vegan without the side effects. This is because vegetables are enriched with antioxidant, vitamins, minerals, which are beneficial for testosterone overall health. In addition to vegetables, are also loaded with carbohydrates, essential acids, and this all help with the production of testosterone. Vegan diet have less calories. Now, this is where you need to pay attention because, and Charlene will share this with you. When the vegan diet have less calories, now your body needs good calories to make testosterone. That's crucial, that's vital, okay? Vegan diet have less calories more than meat diet. And that's why some people, you know, even here where I'm in South Africa, meat eating is a big thing. And folks will tell you, you're not a man if you don't eat a meat. That's because that's what they feel. And they are getting certain amount of calories. They are getting certain benefits down there. But what the meat tends to do, it tends to block up your arteries. Then that affects another system that helps you with your male reproductive organs. So it clogs your arteries, so that's going to mess up with your circulation. And circulation is the next topic I will be looking at. How circulation affects you as a man. And that topic I'm looking forward to so much because there's so much we're all going to learn from that one. Okay. So meat diet, it does have its fats in it, and that can for a while help you with your testosterone, but ultimately the side effect is going to block up your arteries and make you sickly. And that's going to stop blood flow from getting down there, man. That's going to cause a lot of problems, a real problem, because you're going to get the heart disease and all kind of things in that process. Therefore, get enough daily calories from using a vegan diet. If you're going to make a change, like the gentleman that was here, we changed his diet. The one that gave the testimony, we changed his diet from a meat diet to a plant-based diet, but we also made sure he had fats from the avocados, from the seeds that we added there, and we reduced the sugars and all that stuff. So we give him all the goodness. Though he wasn't taking the meat, we were making sure that he had all his calories and his fatty acids. Okay, so when a person runs low on calories, your endocrine system and your reproductive system are the first ones to be affected. Okay, so you don't want to run low on calories. You don't want to do that. Okay, you want to keep that level okay. Okay, you don't want to run low. So you need to understand food preparation and food combination. Very important. For those of you who are not on the WhatsApp group, men, we have a men WhatsApp group, and I think they also have a women WhatsApp group. Please get in touch with one of the members of the group or put your number on there. I'm sure one of the hosts will take your number down and add you to the men group or the women group. You will get more information. Daily information will be shared. This week, I will make an effort to share information in regards to testosterone production and testosterone levels in terms of what you can do. So join the WhatsApp group. I will make an effort along with my colleague, Dr. Kamosa, to share information on what you can do. It is very important, guys, very important that you keep your testosterone levels right, because when that system starts to go funny, you become a different man. You don't just look different, you become different. You are indeed changing. Okay, you become a different person. It can do that to you. Okay, therefore, nourish your body with a significant amount of calories and use proper ratios of fat and carbohydrate and protein. I've put a link. I will make this presentation available so you can go and do your research. I will try and give it to one of the hosts. You will tell them, they will put it at a place where you can all upload it, or they'll send it to your email or something like that. I don't know how they do it. Right now, however, I'm going to ask my good sister, Charlene. Charlene, let me finish and then you just take over and then I'll come back. So some of the vitamins that you need, crucial for the production of testosterone, is vitamin A, K, and D, fat-soluble stuff. You need this in your system for the proper production of testosterone, okay, for the necessary formation of testosterone. And then to help with the brain, where the hypothalamus is and the pituitary gland, you need to have things that keeps that system. And that is your 5-HTP, your niacin, vitamin B3, and your B in general, okay? And something special, zinc. Now, I'm gonna do a special program on zinc, but let me finish the series on men's health in regards to the different anatomy and physiology and reproductive system, how these systems, work together. I'm gonna do a special program on vitamins, minerals, and zinc is gonna be that one. And that program is gonna be very, very intense. You're gonna need to come out with your pencil and your pen. Also, just so you all know, we are planning a training. And this training is not for no specific group, it's for everybody. Everybody is welcome. We want everybody to be healthy. We are going to design it in a way that you, your wife, your children can learn and become healthy. Remember, guys, without your health, you can do nothing. You can do nothing. Just remember that. You're not going to go far. If you're a pastor, you're going to preach your last sermon soon when your health is gone. Furthermore, before you get there, sometimes you won't even make it to church. And because you're sick, you will spend most of the time praying that the Lord relieve you of your sickness. You will not be able to meet your mandate according to what God wants you. If you're an accountant, a doctor, a lawyer, you will only have the title. If your health is gone, you will not be able to carry out your duties, neither to yourself, nor to your family, nor to your community. Okay, so these nutrients are crucial. We're going to do a proper training. We want everybody to be a part of it, anywhere in the world. We're going to do a Zoom level 1. And then for those of you in South Africa, if you want to get hands-on, then you will be able to, at a later date, when the lockdown situation changes, you'll be able to come in. But for now, we will use Zoom to create a very wonderful weekly training that everybody may be able to be blessed by it. So get good enough quality supplements. Go to your health food store and get good quality supplements. You've seen them there on your screen. Write them down. Also, consume sufficient dietary fats like olive oil, coconut oil, pumpkin seed. And look, when you talk about diet, people are going to have other things to say. Somebody else is going to tell you mustn't use coconut oil. Go and do your research. It's important. We are only sharing stuff with you, but go and do your research. Understand where they're coming from. Maybe they've read one. You know, they say perspective makes all the difference. Get a good perspective on why they say you mustn't use coconut oil and why they say you must use it. You must understand the full perspective, and then you will be able to make a better decision. Pumpkin seed oil, avocados, and most of your nuts, they all have good fats in them, your omega-3, and that you will get it from your flaxseed and different nuts, walnuts, and soybeans. Sister Shirley is going to do a live demonstration for you as soon as I'm finished. Although I believe, according to research and observation, that a vegan diet is better than a flesh diet, it's important to understand that all diets come with their pros and cons. So it is always wise to strike up good balance when making changes, okay, in your diet. So you don't want to leave your meat diet and end up in a vegan diet and become sickly because you have not understood how to take the nutritional benefit out of the meat diet and apply it to a plant diet and get your nutrients from a plant. It don't make sense you just say I'm a vegan and you go and eat food that makes you sick. Then what's the point? You want to say you're a vegan? So the other person is eating meat, yet he's able to be a doctor, be a lawyer, be a preacher. You're not able to do nothing. The only thing you're able to say, you're a vegan. What's the point? Okay. And by the way, that sometimes is the case. You need to understand your body and its requirements and how to get the nutrients into your cells, not just into your mouth. If your body is not able to absorb the nutrients from the food, then it's just passing through your system. Okay, you need to get the nutrients from the food into your cells. That is crucial. Digestion, okay, is one thing, but absorption is everything. All right. Some of the herbs, we have mentioned them. There's many more. I will share it on the group. Join the WhatsApp group. Tribulus, Duncurry, and maca powder. I want to focus on just those 3 for the moment. You can get those from your normal health food store. Another one I want to mention is ashwagandha. I spoke about it earlier. Now, this is not the first time some of you are hearing these things, but understand, these are the things that I put inside of our portions, and the right combination of these herbs can do wonderful things. As the gentleman was saying, he came here, he was struggling to urinate, just a combination, just a simple combination. I made it within 3 days. His urine started to flow, his erection started to come back. It's that simple. All right, diet change, lifestyle change, put a herb. The Bible teaches us that, for those of you who believe the Bible, and I'm not telling you what to believe, but understand the Bible says this: the herbs are for healing. Some of us confuse food with herbs. You think food cannot do certain level of healing. You can change your diet. Yes, it creates a condition for healing to take place, and yes, a level of healing takes place, but food cannot alone. It doesn't heal like that. You need to understand the chemistry. Yes, some diseases, yes, some lifestyle diseases can be altered just by changing your diet, if that's the problem. But when an organ is damaged and an organ needs repairing, you need to go beyond food. You need to go to lifestyle, herbs, food, supplements, and a lot of these things is what's going to bring the change. Some of us think that diet alone is going to do it. If you're not careful, diet will make you sick if you don't know how to make proper food combination and proper food preparation and proper nutrition absorption. Okay? And Charlene, I'm telling you to take the platform as you do your demonstration. I pray that everybody, will enjoy it and see. The New Start program, as I close, as Charlene get ready, New Start, we understand nutrition. make sure you get good nutrition, testosterone, sunlight. I spoke about vitamin D, water, crucial. You need enough water in your system to be circulating, to be cleaning your organs, and also helping your blood to be able to be at the right consistency. Where am I? Temperance. Make sure you do that which you are to do in moderation and not excess, and stop what you're not supposed to do. Okay, that's what temperance means. Rest. Make sure you get enough rest and enough exercise. And then the middle one that there you see, it says trust in God. This is not a Christian platform per se. In other words, this is not a church group. This is a group where everybody will be able to take information from here, whether it be about nutrition, water, sunlight, testosterone, central nervous system, whatever. This is a platform where I don't care what group you're from or what denomination you're from. This platform is designed to give you basic knowledge in how to look after your health. That is crucial. But as for myself, I am a Christian. And so trust in God is very important as we make these changes. If you're not a Christian, then I suggest that you make sure you have a clear mind, that you're able to seek and search more for God's divine hand and for his almighty power. For us though, and for myself, I know that without God, you can do all of these things and it will be like nothing. And so I put it in the middle of the screen. Trust God as you make these changes. Sister Charlene, if you don't mind, I'm going to stop my sharing. Save your questions, everyone. We will answer them just now. Sister Charlene, are you ready?
I am.
All right, I'm going to close off. This is Sister Charlene, my good friend. She's from the UK, and she will be sharing with you how to fortify your food so you can get more testosterone. Okay? Remember, men, testosterone. If you ain't got enough, you're going to create a problem. You're going to become a different man. Okay? You have seen it amongst the older ones and even some young men. They just change. They become very, very much no energy, very much weak, very much limp, very much, you know what I mean? The ones like, you know, when my testosterone drop, everybody's going to go, all right, Jason, something is wrong, because everybody knows I'm loud, I'm energetic, and so as my testosterone go down, you're gonna know immediately. And I will also know because of the knowledge, but I will try my best by God's grace to keep it up so I can be more efficient and more effective in my daily moves. May God bless you all. We will take questions. Sister Charlene, over to you as I stop my screen.
Okay. Hello, everyone. I'm Charlene. So we are going to make a nice, healthy, nutritious salad. So what I've done, I've already chopped up these already. So this has got, sorry, let me just
tilt your camera, sure,
so that you can see.
Yes.
My
Yes.
table. Okay, so I've already chopped these up, but this has got in there pak chow, lettuce, romaine lettuce, and broccoli. Now, I know some people are thinking broccoli raw. Some people may not have had broccoli raw, but if you cut it up fine, you wouldn't even know it's in there. So broccoli, pak chow, and romaine lettuce is in here. So what I'm going to do, I'm going to put a bit of avocado, slice up small some avocado pieces, just like that, into the salad. And as Jason was saying, avocado, because of its fatty acids, I'll do another chunks. So there's avocado. So now I've got here on this plate, we have walnuts, pumpkin seed, and sunflower seeds.
I was gonna say pumpkin seed.
I have got chia, but it's already grounded, so I'm not going to have to grind that. So what I'm going to do, this is my coffee grinder. No, we do not drink coffee, but it's a good tool to have to make your seeds go fine. So put it in here. I'm just going to grind it up so it's nice and powdery. All right, so probably do about 1 teaspoon. So look how fine it is now. That's how fine it is. So we're just going to sprinkle it on the salad. And then what we're going to do, we're going to add some yeast flakes. Now this has got B12 in there as well, but it also has B3, B6, folic acid, biotin, iron, zinc, protein, fiber. So we're going to sprinkle 1 teaspoon in there. In the salad.
That's what I use it.
And then what we're going to add now, Himalayan salt, fine Himalayan salt. Himalayan salt, this one and Celtic salt has got around 92 minerals that the body has within the body. So we're just going to add maybe 1/4 of a teaspoon, if that, just like a pinch, and just put it in the salad. Oh, I did add my chia seeds. So I'm going to add some chia seeds in there. Just a little bit.
Be nice.
Then,
You too.
and then we're going to add some flaxseed oil into the salad. And some flaxseed. Just drizzle some over the salad. And some coconut oil into the salad. Right, now this is like this. So I'm just gonna have to do a little bit in here so not everything comes out. Just a little. And then what we're gonna do, we're going to mix it up together. And then that is a nice, healthy, nutritional salad. And then what you could do, you could add tahini. I'm not adding it into this, but you can add tahini. And tahini is absolutely amazing. Tahini is really sesame seeds, and it contains antioxidants. It contains vitamin E. It contains your vitamins and your minerals. So tahini, you can drizzle that in there as well.
Answering you.
Add that in there as well. So that is the salad, Jason. That has everything for your testosterone.
That's right.
There we go.
So thank you very much, Charlene.
You're welcome.
And it's that simple, guys. You see, food fortification is very important, especially when you do the diet change. I'm sure my good friend Alvin will do a wonderful full presentation on that. That's his gift. Let's put it that way. And more than that is his speciality as well. Alvin, you will do that one day where he show you how to take simple food and make it into magnificent nutritional powerhouse, and tasty. Let me add, very tasty. Okay, that's just a simple thing. Now, everybody should be able to make a salad and add those things to it. You see how simple it is. Charlene just took some pumpkin seed, and by the way, pumpkin seed is loaded with some of the nutrients that is necessary for your testosterone and for your male reproductive system, because it's got zinc in there. And she just put pumpkin seed, sunflower seed, and then I don't remember the other seed, and some nuts. What's the other seed, Shirley?
I put chia seeds, walnuts, pumpkin seed, sunflower seeds in there.
All right,
yeah.
And that's
cool.
And then she added the coconut oil in there as well. Now that's making sure. Remember, your body needs these fats to make this testosterone. That's the key there. And so we just shared with you how to make a powerhouse salad to help with your testosterone production. That's what Shirlene has done. Thank you very much, Shirlene. And that's what this show is about. It's about teaching you reasonable theory so you have some understanding of how your body works and what it needs to function at optimum. I am going to sign off now, and then I'm going to take some questions. Remember though, as you go this week, let me just throw the challenge out from my side. Make a salad like what Shirlene's made. Get some coconut oil, get your seeds, blend them up and put it in it. Every day, have yourself a bowl of salad. That's your challenge before you eat your main meal, okay? Every day, that's your challenge today for the next week. Increase your salad, your raw salad intake. It is important. Some of you will find it wonderful. And as Shirlene has shared with you, a very crucial piece of information. She used the sea salt, the Celtic sea salt, I believe, and it had trace minerals in it. That trace mineral, as simple as it is, your body don't need a lot. It just need a little. And trace minerals, you know, the deficiency of trace minerals, believe it or not, it can knock your pituitary gland out if you don't have enough minerals in there. So make sure, as simple as it might sound, put that back in your system. That little piece of salt will do that. Pink Himalayan salt can do similar as well. And as I go, remember this, health is not everything, but without your health, everything becomes nothing. That's me, Jason Williams, coming to you from Wangkamani Institute of Wellness, South Africa. Until next time, may the good Lord of heaven keep you and bless you. Have a wonderful week. And over to you, Sharon. Thank you very much.
Hello again, everybody. So we've had another episode of TTI Family Health, focusing on the male testosterone level. And I'm sure that, well, there was so much in there. I'm sure there's a lot that you've learned. And some of it may have been a reminder, you know, things like ashwagandha. I've heard of that. Never tried it, but I think my husband has. And some of it may be totally new to you. But we do have some questions in the chat. So I'm just having a look on here to see, and a lot of them you have dealt with. You have covered quite a lot of them, as well as Dr. Louisa as well in the chat room. So just going over these. Okay, one of them was what vitamins and mineral supplements can be taken. I know you covered zinc and vitamin D. That was mentioned as the most important ones. One interesting question, how does one reduce the testosterone? It was answered in the chat, but I'm going to put this one to you, Jason. How does one reduce the testosterone? And I could give you the answer that's in here, so a bit of background. Well, one person said, Dr. Louisa says, the body decides how much testosterone it needs, and if you try to lower it against your body's needs, it will affect your health. But right. Let's hear what you have to say, Jason.
Right, now, listen, yeah, it's a rare thing, especially in the male productive years, say about between 20 and say 35. It's a rare thing to have too much testosterone, but it does happen. It does happen occasionally. I forgot the percentage rate, but it's a very small amount. It does happen because, listen, the pituitary gland, yeah, the hypothalamus system there. Let me tell you how it is, yeah. It's like, in a physical way, it's like me holding you on the hedge of a building, and I will not let you fall. Now, I want to hold you by your collar, like so. I want you to get something, so I'm going to hold you. I'm going to let you down just enough to get it. And if I feel that you're pulling, I have enough strength to pull you back so you don't fall. And when I feel that you're too much, you're not getting to what you're supposed, I will let you down again. The pituitary gland, and that's how that system works with your testosterone. And what am I saying? When there's an increase, the body go, ooh, we can't have this. It changes. Now, listen, you see if that doesn't change, see if those increase doesn't change, you see it happen. You see it happen. People go mad. They go mentally nuts in their head. Okay, that's what happened. And sometimes that's how powerful that is. If that system does not work, you will become a different person. It will ruin your life. Now, in terms of how you reduce it, now, what Dr. Kamo says is spot on. the body has that's why it says tightly controlled system. It controls it very, very well. It's like the temperature. If your temperature go too high, I mean, you're moving from 37 to 40, it's not that much, but let it get to 40 and you feel like a pain in your head. Now, there is ways that you can do it, okay? But you will not be able to do so safely. If you have high testosterone as a man, and the doctor tried to mess around by giving you hormone, he's gonna knock your system out. He's gonna knock your system out because he's trying to bypass the pituitary gland, which is very powerful, guys. If you look at where it is, it's very much deep within the brain. He's trying to bypass that system by using chemical. Now, when you bypass that system, you mess up everything, yeah? You just mess up everything. That's gonna make you sick in the long run. So it's a very, very technical thing, Sharon, in how you reduce it. So if somebody, a male, is suffering from what you call testosterone dominance, now remember, there's a range that it runs between 270 to 1,000 something. There's a range. I'm not talking about when it gets to the higher range, close to the 1,000. That's still within range. That's still within range. I'm talking about when it gets over that 1,000 and beyond over there you got problems. Now, if it's genetics, then you're going to end up with a mental illness. It's going to mess up your head. You're going to end up sick because the brain is not going to be able to deal with this thing. It just won't happen. You're going to end up sick. Okay. If it's something that happened as a result of an accident, there is, depending on how damaged the brain is, as I was researching, there is certain things that can be done. There's medication out there that they give you to help calm certain things down at a level. You will still not be the same ever again, really. However, there's the intervention of diet and herbs and supplements and nutrients that can also aid in bringing things back in control. But it's a very rare thing you can have high testosterone, guys, but it is within certain limits. You understand me? But if it goes outside of that perimeter, it creates problem for the body. The body adjusting is a serious issue. And so that can cause some serious problem. But for females, a female can have a dominance of testosterone, which doesn't affect them that much. And that could be balanced by just switching things around because they don't have that much testosterone in them anyway. So it will have some effect, some negative effect, but by just changing their diet, you can do that. There's diets that is predominantly estrogen heavy or testosterone heavy. You can change that very much with a woman. Like a woman's dominance in estrogen, you can change it by playing around with their food and nutrients. You can bring it back. But when a man one goes way over, it's a very different thing. That it has a very serious impact on their health, and it's not a normal thing.
Thank you very much, Jason. That was a full answer. One other suggestion was, you'll like this one. Here we go. If you feel you have a lot of testosterone, just channel your energy into other work. Can't get much plainer than that. Okay,
yeah,
there's a lot of work
that's if it's within. Once it's within the range, then fine. You can challenge. You will have it. You will do so much. You'll have energy. You'll be upbeat. You'll be strong, muscular, whatever. Once it's in range, but once it pitch over, you're into a different zone.
Okay.
Okay. Mm-hmm.
I've got a question. You said something early on in your presentation about women's level of testosterone. If the balance isn't quite right, you tend to notice certain things like possibly the odd facial hair, HAIR, the odd facial hair. So if a woman does have excessive hair, does that always mean that her levels of testosterone are too high?
No, Sharon. It means that it's there because it's a male hormone. It doesn't mean that it's out of balance. However, let me say this, coupled with other changes within, like say the monthly cycles start going funny, you're not able to produce, your cycle every month, you're missing with the hair, then you probably want to look into what's happening with your hormones. But you can have, some people, you have a little hair here, it doesn't mean much. Yes, it means you got testosterone in your system. It doesn't mean that it's going to knock your system out. You know what I mean? But if it's coupled with the effect of hormone imbalance, then yes, you need to go and check it out.
Okay, thank you very much.
Another thing, sorry, Sharon. Another thing I wanted to say that I didn't say is men. One of the things as you get older, yeah, and your testosterone level drop really low, yeah, your male reproductive organs start to shrink, yeah, it will shrink away, you get very small and wrinkled. All right. Also, overdominance of estrogen can also cause that. So, like for bodybuilders and people who take artificial steroids, you would notice their goonies are very small. And so what's basically happening, they're putting in chemicals that enhance their steroids levels. And so the body gets into a zone where it's like, oh, so this chemical is here, just like the pancreas, yeah? Just like the pancreas. This chemical is here. I don't need to make no more. So your goonies go into retirement. So they start producing their own testosterone. And so as a result of that, this thing shrinks. It just shriveled it up. Same thing with your pancreas. Your pancreas is a part of your endocrine system. Once it starts producing so much and you start putting in insulin in your body will stop making insulin. So a type 2 person will become a type 1 diabetic in no time because you're putting in fake insulin. So it will stop making insulin. You understand? So that's how that system. So too much testosterone will shrink your goonies, and not enough will also shrivel it all up.
Okay, thank you very much for that, Jason. That's clear. It's unfortunate it's getting a bit dark where you are. We're struggling to see you.
It's getting dark, yeah. I can turn the light on.
But nature.
Sharon, I'm just wondering if anybody have any burning question they want to ask that they haven't put in the chat.
Yeah, before we take that, thank you very much, Shirley, for your presentation of the salad. And I'm sure that people will try that out this week. I think we've got all the ingredients mentioned in the chat. I think we've covered it all, so thank you. And we'll probably put something in the WhatsApp group with regards to smoothies that can be used to help boost testosterone. We have some recipes, so that will come in there this week. And we have the invitations to the WhatsApp groups. If you've not joined yet, the invitations are also there in the chat. So please have a look through there and join up with us if you haven't done so yet. Okay, do we have anybody that would like to unmute for a question? If you've got a burn, not might be burning, but yeah, a question that you'd like to ask. If you're a bit shy to come on camera, maybe you could keep your camera off. It's nice to see you all though, because we're all brothers and sisters. But if not, you could also put it in the chat, a question. And thank you for the comments as well. There's been some nice positive comments in the chat. So appreciate that. Anybody? Okay. It may be that it's a sensitive topic for some of you and you may feel a little bit shy to ask your questions. So we do have the admin team on the WhatsApp groups. You can send direct messages. Some of you may have done that anyway. You may have sent it directly to Dr. Louisa or to Jason. So I suggest that Jason, now that you've finished presenting, you might want to check your messages. I'm sure you've been doing it anyway, but it's a lot easier when you're not presenting. Okay, was that somebody unmuting to come on?
Yes, I got a question I wanted to ask.
Go ahead, Rico. Yeah.
Yeah, my question was about saw palmetto, if it's recommended like a regular thing to take the tablets.
Sorry, what was that again?
Yes, I heard the
Saw
question.
palmetto.
It said, saw palmetto, is it recommended to take it regular? All right. Herbology is very important. And I can really simplify it for you right at this point, actually. And you will be able to get the answer where I'm coming from. If you know rice is a good source of carbohydrates, or yam is a good, would you eat yellow yam every day for your carbohydrates? And what you think will happen if you keep eating the whole yellow yam every day, yellow yam, yellow yam, yellow yam, yellow yam?
The buildup of one thing too much in your system.
That's right. Because these things are complex, you see. They got loads of phytochemicals and nutrients. So yam, the carbohydrate composition of yam is just one little aspect of it. But the entire nutrient buildup within that yam does so many things. So if you use it thinking carbohydrate, it's going to create an imbalance in the system because of the other trace minerals in there, which is able to, you know what I mean? It gives your body what it needs, but on the same level every day, you're going to cause a problem. So with that said, I think you understand. I wouldn't recommend that you use saw palmetto nor no herb on a consistent level basis. Now, if you understand how to combine the herb, to complement it and fortify it so you can use it for a prolonged period of time, so you get a slow release or a controlled balance of the medical property of which you're looking for, then you have mastered how to use it for a prolonged period of time. For example, we have a tonic. We call it the prostotonic. It is a combination of herbs combined in a way that your body don't get knocked out by the saw palmetto. Yes, it has some saw palmetto in it, but it is designed so as your body take it in, you know, it is able to use it. So you'll recommend to use this drink probably 3 times a year if you're healthy, to stop changes. But if you have a benign prostate issue or benign prostate hyperplasia that's taking place in your body, then you can also take it for a regular period of time, probably for about a month, then you would need to stop. Long-term use will create imbalances in the body because saw palmetto is quite strong. It will give you hair loss and it will create hormonal disturbance if you're not careful. It may baldness. For a woman, it will make your hair grow. By the way, it can also make you bald. It's one of those herbs. You got to know how to properly combine it and formulate it so you can use it without getting a negative effect. So no, I don't recommend consistent use of it, though it is very good for the male reproductive organ, especially benign prostate hyperplasia, which is enlarged prostate. I'm giving mouthful of answers, I realize. I just want to make it clear it's not normally what I do. Perhaps, you never know, my testosterone might be changing. I'm talking a bit too much.
It's fine, Jason. I have another question for you anyway.
Yes.
Do erection boosters improve your testosterone, or they simply improve blood flow to your genital?
Depends on what it is. For example, let's use a common one. Something like, what's the common one that out there? Viagra? Let's look at Viagra. Okay. Viagra, the base of Viagra is L-arginine. And we know L-arginine is a vasodilator. It helps with blood circulation. But it's the other things that it got in there that pushes your heart that cause that. So that one works primarily on your circulatory system in getting more blood to that organ. All right. So that's how that works. However, if you have a heart problem, then I think I've never used the thing, by the way, but I think they should definitely have caution on there for people with heart problem, because it can give you a heart attack. Yeah, because it pushes your heart to make more blood to push it. And so the whole working is it gets your heart to push heavier whilst it opens your blood vessel so blood can go through. That's how that one works. They have other ones that work on your central system. Like, you know, some of you from the Jamaican background, everybody ever heard of something called stone? Yeah, stone. They call it stone.
Yes, sir.
Yes, that one works on your nervous system. That's a different approach. So that one, it will damage your nerve. They're not natural. Don't use them. That's all I'm saying. Use natural ways. Exercise, good nutrition, keep your blood right, get your heart right. You know, you can use L-arginine. L-arginine, when your body's low in L-arginine, it loses the ability to, the metabolic ability to open the blood vessels properly for flow. So if you use L-arginine, you can get it in the store. You can use it over a period of time. Change your diet. Change your diet. Very important if you want to get good erection without the side effect. Change your diet. Go on to a plant-based diet. Okay? Make sure you're getting the right fatty acids as Shirley show you, and use the supplement L-arginine and zinc. Use them. Okay? You can also use things like 5-HTP and tryptophan and that, which is going to help with the mental space. But for the physical space, L-arginine and a good diet. And if you want a herb that goes along with that, drink some ginger tea and a little bit of cayenne pepper. Now, you need to understand that these things are going to make the blood flow. Okay, it's dilating. It's going to dilate. Ginger, it's got the active ingredients of ginger is very, very well. And that's probably enough. If you got erectile dysfunction and you made the lifestyle changes, you made the diet changes, you're going to use L-arginine, then use a herbal intervention, use ginger. Ginger alone can do it, because how ginger works, ginger doesn't necessarily dilate the blood vessels so much, though it has that effect, an anti-inflammatory effect. What ginger does, it changes the consistency of your blood so your blood is not thick, so your blood can go through your vessels better. Whereas the L-arginine will open up the blood vessel. The ginger will help the blood to maintain its proper integrity as it goes through your arteries. As you change your diet. This is how you restore your proper erection if blood flow is an issue. If it's nerve, then you got to go back to the parasympathetic and the nervous system.
Great answer there, Jason. And also ginger tastes good. So, hey,
very well.
double blessing. Okay, I believe we've come to the end of our show. So thank you for all of you who've tuned in. You've had a thorough presentation on the testosterone crisis and the endocrine system.
Sorry,
so
sorry, Sharon, there's a hand up. Nothing. Nothing.
Oh, sorry.
No, it's okay. Sorry, I just saw it go up.
Yeah.
Nothing.
Go ahead, Nathy.
Oh yes, I've got a question here. Does testosterone has anything to do with increasing the breast size of a male?
Yes, low testosterone level. As you get older, you will see it. Low testosterone level, yes, that is one of the giveaway sign. You hit the 40s, you start getting older, it can definitely cause, and also not only the increase, it can make it also sore.
Okay.
Mm-hmm.
Okay, thanks a lot.
Okay, is that it, Sharon? In closing comment, let me say this. Females, when we do I'm gonna say it again, and Sharon, you will also share it with the female group. When we do the male day of things, we don't want the female to run away. This is supposed to be a program. It's terrible when we see men come in here who have been married for many years, and their problem was caused by their wife's way of cooking for them. Their wife's the one that created the food, that created a lot of the imbalances in their body. Now they're sick, they're crying over their husband when it's them that do it. Female, don't hide away from these programs. Please be a part of it so you can know the symptom and sign of that man who is closer to you. So you are able to, even when he's trying to hide from going to the doctor, you are able to listen, see, and know that something is going on without, I'm going to say this, without him feeling ashamed to tell you. You are able to adjust yourself and say, hey, you know, my husband is not the man he used to be, you know. Things are changing. I remember that program. Let me go down to the health store and let me buy this, and let me buy this, and let me try and start giving him some to take without you saying to him that, because you don't want him to feel, you know what I mean? So you're just using wisdom at another level to help your situation. And then you will also observe the changes as you change their diet, as you change their lifestyle, as you buy some L-arginine, as you help, you get what I'm calling, you say, "Hun, let's go for a walk, let's start walking." Then I don't feel like it. I know you don't feel like it, hun, because your testosterone is dropping, but you're saying that in your head. You're not gonna tell him that, okay? And then you can make dietary changes in your household that benefit his testosterone to come back. And the days when he said, "Hey, you still want to go walk? Let me go walking today." Then you know, my husband is coming back. You know what I'm saying? That's why I'm saying females, don't hide away from this program. It is designed for everybody, so it could be a blessing for the family. And we all know the Lord placed the man at the head of the home, but also we all know that he ain't going very far without Eve. So let us do it together and work together for God's sake. May God bless you.
Jason, just before you close off, we have one person that put their hand up, and maybe this is just something that they need to learn. Kimberly, can you unmute, please, and ask your question?
Hello. Good day to all.
Hello. Good day.
The question is this. Constant use or a regular use of ginger, does it cut the fat from within your body?
You asked, does it, what the facts are? I didn't hear.
If constant are using ginger regularly, does it take away the fat from your body?
Okay, I hear you. All right. I hear you. I'm going to try and answer your question by sharing something now. Taking away the fat from your body, that's a terminology. Let me refine it a little bit. I think what you're saying is, does using ginger help you to lose weight? Or are you saying, does using ginger help to clean your arteries? Which one are you asking?
Cutting the fat from within your body, your belly, belly fat, to be more specific.
Okay, all right. Yes, in the Caribbean, we say that. We say this thing does move fat from your belly. Yes, we do say that. In truth, what is going to remove the fat from your belly is proper diet, proper exercise, proper nutrition. It is a sign that also the belly fat issue, guys, it is a sign that your testosterone level is dropping. So if that is the reason why we have the fat on our belly, Mr. Kimberly, then you see ginger will not help to remove the fat so much. Though it will help with digestion, it will help with a lot of things. But what you will need to do is perhaps get your testosterone level back up so your body can metabolize that fat and burn it away. That is the way how you would approach that. But to say just take ginger alone to burn the belly fat, it's a good thought. But in practicality, I don't know if it works that way.
Okay, thank you very much.
All right.
Thank you, everybody, for tuning in to this week's edition of TTI Family Health Show. And this sun by me is only like, it's fake, it's not real. And I need to get out there. So for those of you who still have a bit of sunshine, may I encourage you to get out and make the most of it before you start hearing the rain. And next week, our presentation is going to be covering the topic of exercise. So please, please come back. You know the challenge for this week, to make some of those salads, and we will put the smoothies out on the WhatsApp group as well. So that's a practical exercise I'm stuck on exercise now. That's a practical thing to do. But next week we're going to have David Bartholomew and some of our local admins coming on to encourage you to get exercising as well as taking up that sunshine. So thank you once again. It's been wonderful sharing this time with you, and my birthday with you too. Thank you. And we'll look forward to seeing you next week. So
God bless.
God bless and goodbye.
Bye-bye.
Take care, guys.
Thank you very much. God bless you.
Thank you.
Thank you. Good stuff. Thank you. God bless.
Thank you.
Thank you, Brother
Thank you,
Jay
everyone.
and team.
Thank you,
God
Jason.
bless.
Thank you, everyone.
You're welcome.
Thank you, everyone.
Charlene, I don't know if this person's still
Yes,
on
sir.
here, Paul, but he was asking about seeds. There's someone that put a question in the chat called Paul, who's asking about the seeds. In your
Oh, is
salad.
sprouting the seeds
It's
better?
to sprout. Well, it's good.
Sprouting is good.
It's going to be getting more nutrition from your seeds that's in that state, isn't it?
Yes, sprouting is very good. Because you've been doing a lot of sprouting, haven't you, Sharon, as well? But
I have
Paul,
been recently, yeah.
it is sprouting is good, especially soaking them. Is good to do. So that's another beneficial way to get the nutrients out of the seeds by sprouting them. I'm not, but also I'll put it in the chat room in the WhatsApp group, and I'll ask the guys to put it on the men's group. But I'm actually speaking tomorrow and doing some DIYs because although it's good to put the nutrients in our body, it's also good to also try to exclude some of the chemicals that's making our bodies toxic as well. So I'm doing some DIYs tomorrow, but I'll put it in the WhatsApp groups.
Okay, lovely, great. Thanks for that.
Oh, you're welcome, Paul. You're welcome.
And
So
I
I'll put it in the chat room if you want to join, but it's late tomorrow. It's at 9:30 because it's on the radio station in Jamaica. So I'm doing it from the UK.
Okay, yeah, that would be fine. That would be fine.
Yes, I'll send the poster out to the
Yes.
WhatsApp groups.
Okay, great. Thanks again.
Okay, you're welcome, Paul.